Hi, I'm Kiara.
Hi, my name's Ian.
We did our internship at Maine Medical Partners Cardiology. This internship is located at 96 Campus Drive in Scarborough, Maine. It is an outpatient facility, meaning all patients are given treatment that does not require to stay overnight.
The commute to Maine Med Partners campus is one of the most convenient for all the offered internship sites. The toll-free commute from UNE is usually around 30 to 35 minutes, depending on if you get stuck by the train or not. It's a straight shot down Saco Main Street, so it's a very easy drive to make considering the other internship site distances. We also know that many seniors decide to live off campus, specifically in Old Orchard Beach. The drive from Old Orchard is even quicker, with the toll-free route taking between 20 and 25 minutes. Along with this, all of these routes can be altered to take the highway to skip the bulk of Main Street traffic. So if you're willing to eat the $2 toll, then you can save around 4 minutes on the road.
Our site supervisor is Riley Sawyer, who is one of the cardiographic techs that work at this facility. Here's her contact information in case you have any questions about this internship site or if you are interested. She's super nice and a fast communicator.
Maine Med Partners is an entirely outpatient testing facility, meaning that people come from all over Maine to get their stress tests done here. Some of the equipment utilized regularly is the Q-Stress, paired with treadmills, ultrasounds for cardiac sonography, and nuclear and PET scanners. Some of the testing we do with this equipment is regular treadmill test, or what they call an MLIT, a stress echo, a MIBI, or a nuclear imaging test, and a regadenoson PET scan. The team you'll get to work with mostly is other cardiac techs and APPs, or advanced practice providers, which are made up of nurse practitioners and physician assistants.
Patients here are typically older, around 60 years of age or more. These patients typically have a lower functional capacity and are getting checkups for the varying heart conditions that they have. Every now and then, there are patients that come in with congenital heart defects, so younger patients, or the Maine Green Claw and Portland Mariners preseason screening is done at this facility. These players are required to undergo testing as part of their preseason screening. I had a marathon runner as a patient come because he was experiencing exertional chest pain and almost beat the entire Bruce protocol. All in all, these patients are typically older, but sometimes you are able to see patients of all ages and exercise capacities.
Some of the learning opportunities you'll have in Maine Med Partners are prepping 12-lead ECGs, logging data into the Q-Stress, measuring resting or exercise blood pressures, prepping and flipping rooms for other tests, explaining the test to patients, and learning the workflow of an outpatient testing environment.
Here are a couple pictures of the internship site. The first picture, starting on the left, is the touchdown area. This is where everyone meets in the morning to go over the stress test for the day. This is also where the printed ECGs from the stress tests are scanned and uploaded to the patient's chart for the doctors to review. The other two pictures are pictures of the two stress labs on site. There are a total of 4 rooms. It's a little hard to see, but the room on the far right shows the echo machine. This room is primarily used for stress echoes, while the other room is primarily used for other types of tests, including MIBIs or MLITs.
In these pictures, the first two show off why people come from all over the state of Maine to get stress tests at Maine Med Partners. The nuclear scanner on the left and the PET scanner on the right are state-of-the-art metabolic function scanning machines. The PET scanner is actually one of only 2 in the state of Maine and is the only one that combines CT scans with PET scanning, leading to this machine to be the prized possession of the diagnostic testing tools. On the far right shows another reason why MMP is such a great internship site to dive into the world of cardiology. Along with exercise testing, there's another wing of the floor dedicated to electrophysiology and devices. The picture shows different generations of devices to check and tune cardiac implant devices, operated by a team of device specialists that love to teach people about their corner of cardiology.
This internship site does a fantastic job at giving interns the opportunity to shadow other clinicians that work closely with the cardiac techs. Both Ian and I had the opportunity to shadow Joe Sala, one of the physician assistants, and Destiny Anair, one of the cardiac device specialists. While shadowing Joe, we were able to see what it was like to see patients and what exactly a physician assistant in cardiology does. While shadowing Destiny, we were able to learn about cardiac device specialists as well as see patients with her who need adjustments or testing done to their devices. If you're interested in shadowing, this internship is a great choice. All of the staff that works here is willing to help you shadow and experience everything that happens here.